Hey guys, today we'll be talking about acute pancreatitis. The term acute includes a severe and a sudden onset, and the suffix itis shows an inflammation. Therefore, acute pancreatitis is a sudden inflammation occurring in the pancreas. Among the patients who visit the hospital due to abdominal pain, 3% will be diagnosed as acute pancreatitis. It also has a mortality rate of 10%. The flat pear or the fish-like organ, the pancreas, is located just behind the stomach in the left upper quadrant of the abdomen. It is segmented into head, body, tail. The major components of the pancreas includes the pancreatic duct, the acinar cells, the islets of Langerhans. The acinar cells control the exocrine functions and the islets of Langerhans the endocrine. The endocrine functions include secretion of insulin to decrease glucose levels, secretion of glucagon to increase glucose levels. It also secretes pancreatic polypeptide. The islets of Langerhans mainly contains 4 types of cells. The beta cells secreting insulin, the alpha cells secreting glucagon, the delta cells secreting somatostatin, the gamma cells secreting pancreatic polypeptide. All these hormones are directly carried away by the blood. The main exocrine function is to secrete the pancreatic juice. The pancreatic juice is carried away by the pancreatic duct that mixes with the bile from the gallbladder at the ampulla of water. It is then released at the sphincter of Oddi to the duodenum. The pancreatic juice contains important enzymes as trypsin and chymotrypsin for the digestion of proteins, amylase for the digestion of carbohydrates, lipase for the fat breakdown. Nucleases, elastases, and carboxypeptidase are other enzymes secreted by the acinar cells. The epithelium layer of the ducts secretes bicarbonate ions in order to neutralize the chyme. The enzymes as trypsin and chymotrypsin are not secreted in its active forms. Therefore, trypsin is known as trypsinogen and chymotrypsin as chymotrypsinogen. These inactive enzymes or proenzymes are collectively known as zymogens. Why zymogens? This is to prevent the self-digestion of the proteins present within the acinar cells and the pancreas itself. The zymogens are secreted in specialized structures known as zymogen granules. It contains protease inhibitors around its membrane. These inhibitors make sure no protease can activate the enzyme during the travel in the pancreatic duct. After reaching the duodenum, these enzymes are converted back into its active forms by the enzyme enteropeptidase. A series of enzyme activation occurs here, where trypsinogen is converted into trypsin. Trypsin auto-activates trypsinogen in order to produce more trypsin. In presence of trypsin, other zymogens as chymotrypsinogen, proelastases, and procarboxypeptidase will be activated. So, during acute pancreatitis, these zymogens will be trapped or will be in excess in the pancreatic duct due to some underlying causes. This excess will take up more space, increasing the pressure in the duct and causing irritation and inflammation of the tissue. Another event that occurs during acute pancreatitis is the lysosomal and trypsinogen fusion. When the lysosomal content is in touch with the trypsinogen, it will soon be activated. And of course, in presence of trypsin, other zymogens will be also activated. The presence of elastase can cause damage to the blood vessels. This can happen both intracellularly and extracellularly. All this leads to the self-digestion of the pancreas. This also includes the acinar cell injury, the epithelial cell injury in duct, the lymphatic injury and blood vessels damage, causing leakage of the digestive juices. So, what causes the zymogens to be trapped or be in excess? One major cause is alcohol. The presence of ethanol increases the synthesis of mRNA, which increases the digestive enzymes and the lysosomal production. This increases the chance of fusion. It also increases the viscosity of the digestive juices due to the impairment of the secretion from cell. All this causes self-digestion. The ethanol can also activate the pancreatic stellate cells or the myofibroblast-like cells present in the exocrine part of the pancreas. This directly leads to fibrosis. The metabolism of ethanol too releases harmful metabolites. They release non-oxidative metabolites as fatty acid ethyl esters and oxidative metabolite acetaldehyde. Both of this causes oxidative stress, leading to the activation of pancreatic stellate cells again. It also favors in forming protein plugs and stones in the microtubules. The oxidative stress accounts for the destabilization of zymogens and lysosomes, again increasing the chance of fusion between the two. Gallstones, tumor, sphincter of Oddi dysfunction can cause block in the pancreatic duct. Another can be bile and pancreatic juice reflux. Steroid therapy is used to solve autoimmune pancreatitis. During this, the T cells attack the beta cells, resulting in type 1 diabetes. But on the other hand, steroid therapy can increase the viscosity of the digestive enzymes. Increase in LDL can also cause direct inflammation by damaging blood vessels, releasing the inflammatory mediators to the tissue. This can also cause amylase leakage to the blood vessel, which is an important marker of acute pancreatitis. Post-endoscopic retrograde cholangiopancreatography and trauma can be other reasons, and the rest is unknown. Acute pancreatitis can lead to several complications. Usually, acute pancreatitis self-limits, but the thin capsule around it can involve the surrounding tissues, mainly the transverse colon, the duodenum, the bile duct, and the splenic vein. An inflamed pancreas can also release inflammatory cells and toxins that may harm the lungs, heart, and the kidneys. It could even result in multiple organ failure. Formation of pseudocysts, which are cystic lesions that consist of leaked enzymes, is another complication occurring in acute pancreatitis. During autoimmune pancreatitis, the immune system attacks the beta cells, which causes the insulin levels to drop, causing type 1 diabetes. Another complication is infection. As pancreas is now more vulnerable to bacteria, it could also lead to sepsis. As the digestion is reduced, the patient will experience malnutrition. So, patients with acute pancreatitis will experience symptoms as epigastric pain that radiates to the back, vomiting, fever with around 38 to 39 Celsius, mushy feces with undigested food residues, fatigue and weakness. Signs of a patient with acute pancreatitis are low blood pressure, positive Gray Turner's sign and Cullen's sign, bowel sounds absent, suggesting paralytic ileus. On palpation, masses and pseudocysts can be found. Lastly, ascites will be positive. For the diagnosis of acute pancreatitis, the medical history of whether the patient was under alcohol consumption or had a prolonged steroid therapy is very important. Plus, the physical examination. Several markers from blood test as the increase of amylase and lipase, leukocytosis around 10,000 to 30,000 microliter, increase of C-reactive protein showing inflammation, increase in bilirubin content showing biliary pancreatitis, decrease in calcium, and hyperglycemia. From X-rays, the colon cut-off sign and senatal loop sign can be present. Ultrasound can show gallstones, biliary obstructions, pseudocysts, and abscess. CT scans can show pseudocysts, enlarged pancreas with the outline of fat layer blurred. Treatments of acute pancreatitis include fluid resuscitation in the first 24 hours followed by the onset, A good oxygen supply. Nutritional support by enteral feeding. Patients should be given a low-fat diet and liquid food is more suitable. Pain control by celiac plexus block. Analgesics are also used. Endoscopic retrograde cholangiopancreatography for the removal of any bile stones. If the bile stones are too severe, then the removal of gallbladder is done. Antioxidant therapies. Most importantly, the alcohol consumption should be stopped. Thanks for watching guys. Do subscribe to my channel and hit on the bell icon.